So I just want to go over some of the basic adaptive equipment that OTs commonly give to patients to increase independence with bathing and dressing. So first I have a long-handled sponge. Any piece of equipment that OTs give to patients that are long-handled in nature are to bridge the gap for lack of range of motion. So this might be used for somebody who has had a hip replacement and they have flexion precaution with their hip, or even for somebody that has limited range of motion in their upper extremity, or even just somebody who's obese and they, for some other reason, don't have the range of motion that they need. So the long-handled sponge can just be used to clean the lower legs. It can be used to clean the back. The handle itself is made of plastic, so if we take a heat gun and hit the handle with that, we can put a 90-degree angle in, which is really great for scrubbing the back. So if somebody has had a shoulder replacement or just arthritis, we can use that. That's primarily our main bathing piece of adaptive equipment, other than using a tub bench, a handheld shower, and then sometimes we just recommend things like pumps on containers so that it's easier to get body wash out. We're also used to recommending things like an all-in-one hair products like shampoo and conditioner all-in-one. Even sometimes you can find 3-in-1 with body wash, shampoo, and conditioner. So we might just do that to make things easier. A fairly common piece of adaptive equipment that we use in OT is a reacher, and you may have seen this. In dressing, this is very helpful to get things up off of the floor, or reach for things in a cabinet, or even if somebody has lack of endurance, they can just reach for different items on the bed. So I'll walk you through something that we use the reacher for, and that's when somebody has a hip replacement and they have their hip precautions that prevent them from bending over to put their pants on. So generally what we'll do is that we will tell our patient to just go ahead and throw their pants out on the ground in front of them, face up, and take the reacher, and then I don't want to break my 90-degree hip precaution there. We'll use the reacher to grab the pants off of the floor and load the affected leg in first. And then we will wiggle the pants up the leg. And then with the unaffected leg, we typically do the same thing because a lot of the times patients are scared of their unaffected leg. So we tell them just to kind of use the same precautions. If a person is more able and they have more kind of agility in that joint, the unaffected leg can easily slide in, okay? So then we'll use the reacher to pull the pants up to the knees, have the patient stand by pushing up off of the bed, and they can pull their pants up the rest of the way, okay? If somebody has a stroke, sometimes we think, oh, adaptive equipment's for everybody, but our neurological patients, we don't always want to recommend adaptive equipment just because if they have any sort of cognitive issue going on, introducing a new piece of adaptive equipment into their life sometimes is just not the right thing. So we have to make sure that cognitively the patient can understand what the adaptive equipment is for and use it correctly and safely. So that's the reacher, okay? You might also see a dressing stick, and it's kind of like a reacher, but it has these little hooks on, which are helpful if you want to have more control of the clothing kind of closer to your body. So we might just load the pants onto this dressing hook here and then lower to the ground and complete our dressing. Most patients don't like these dressing sticks. Some do. Some really like them, but most of them prefer the reacher because it almost looks more like a hand. What is nice about the dressing stick is that you can reach for your shirt. You can use it up here to help pull your shirt off or bring the shirt around this way. And this other, these hooks, since they are plastic tip coated, this is helpful to help get socks off. So you might just put this in the cuff of a sock and push it off, okay? The reacher has something to help you get your socks off as well, but it is metal tip, and so we do worry about if a patient were to do that and scrape their leg, and if they have any sort of neuropathy or nerve issue, that they might not feel that they scraped their leg. So I don't always recommend that. We also have a long-handled shoe horn, and again, because it's long-handled, it would bridge the gap for lack of range of motion, but that can go right down in a shoe and help somebody get their shoe on if they can't bend over. And probably one of the most favorite things, patients are always just like over the moon amazed by this. This is called a sock aid. There are a variety of different sock aids out on the market, but this one is my favorite because it's pretty easy to use. So a patient can stick this under their arm and load a sock on, or they can just squeeze it and load a sock on. Because patients tend to be inclined to put the sock aid here in between their legs and adduct, and you definitely do not want to do that if somebody's had a hip replaced. So the sock aid works like this. This is like the bottom of the foot and the top. And so you load a sock onto a sock aid. Okay. And you never want to bring the sock above the sock aid or it gets stuck. Now here comes the long handled part. So it allows you, it has little hooks here. And you just put the sock down on the floor and you can load the foot right in, and then you just wiggle back and forth and give it a little pull and the sock goes on, okay? So really this is the only thing, it's a sock aid. That's really all it can help for is a sock. It doesn't really do double duty with anything else. They do make double sock aids, so you have one U-shaped form here and another U-shaped form that's together. Maybe for women who wear nylons or any sort of like Ted hose stockings, but this is pretty great, okay? And last, I just wanted to show you a button hook. So this is very common for one-handed dressing. So this might be used for somebody with an amputation, or we might give this to somebody who's had a stroke. It is kind of tricky to use, and so I'm just going to put this shirt on. And while I'm here, I might as well show you one-handed dressing technique. So it's not a piece of adaptive equipment, but in OT, if we get somebody who has had a stroke, we always tell them to dress their affected side first. And so we would just, if my right side was affected, we would just load that side into the shirt and just work it up around. Now this can be where a dressing stick would come in handy, where we could kind of rake this around the back. And again, these aren't always awesome, and I'm impatient. So I'm gonna pull this around. We all make mistakes. And put the shirt on. Now, if I have no functional use of my right hand and I only have my left hand, then this is the one I'm working with, okay? So with the button hook, what we do is we just go in through the buttonhole, we grab our button, get it hooked, and then we bring it through. Now, a lot of people will say, well, isn't it easier just to kind of work with the button and just use one hand? And yeah, you can, but even just getting the two pieces of the shirt together, sometimes that's all that you need the button hook for, is just to keep the shirt together, okay? Now, if this was my shirt and my left side was affected and I had my right side available, we would have to line my shirt up. And I would have to, it's a little bit of a visual perceptual nightmare, but I would have to come in from this side and loop it. Okay, so that might be a little challenging as well. Okay, and so that's it as far as the basics, the most common things that occupational therapists will incorporate into bathing and dressing interventions with the adaptive equipment.